Hey guys, this is my student-led discussion. I hope everybody's quarantining is going well. Um, but I'm going to talk about my article that I posted, or Jeff posted on Perusal. Seems like forever ago. It was last week, I guess. Talking about in-game management of common dislocations. Um, this was written by Nathan Skelly, Jeremy McCormick, and Matthew Smith. Overall, I think it was a really cool article. It went in depth with each of the dislocations and how to actually reduce them. And it talked about the most common dislocations. So in what direction was it, anterior versus posterior? Was it more inferior? And then what positions you should place the individual in order to reduce the dislocation. So whether you have to apply an axial load or put them in a different rotation or a different positioning to aid in the reduction of the dislocation. So I thought it was really interesting to kind of read the step-by-step process for all of that. And I thought it did a really good job of explaining everything anatomically and how best you can reduce the dislocation. I think it was very cool how they talked about in-game management. So obviously, depending on state laws and if physician signs off on you being able to actually reduce dislocations, there's not too much that we can do as athletic trainers unless we are obviously cleared to do that. But obviously, they're talking about in-game management as being the best outcome that you can do. So reducing on-site is the best thing that we can do in order to reduce any neuropathies from occurring, any closing off of blood supply. So the quicker that we reduce it, the better. But it also talked about additional injuries that can occur with dislocations, which I think a lot of time people don't think about those. They think about the dislocation itself, but obviously reading through this, there are a lot of dislocations that also are commonly seen with fractures, and without any imaging at that time to do that, we're kind of unsure of whether we should be reducing it or not. So Bree had mentioned about on-field imaging and why that would be an advantage, mostly obviously because we want to look to see if there's any fracture or any other injury before we reduce, because if we're reducing and there's a fracture, we can cause further injury, putting the athlete in more pain, and then also possibly leading to some more advanced injuries that we'd have to deal with. So I don't have too much to say, only because it really goes in depth and the descriptions of everything. Obviously you've read this, and again, it's pretty cool showing you what the evaluation is, the reduction, and then also the management after the reduction. So I think it was a really well-written article, and to be able to read this, and we'll be able to do this soon as athletic trainers. I think this will come in handy just to have this in the toolbox. Yeah. I don't have too much else to say. I'm sure that we've all seen a lot of dislocations. This is so weird not being able to just talk with you guys. But I'm sure all of us have seen at least a finger dislocation or something like that. I've seen some more intense ones, like a shoulder dislocation. We had an athlete actually have a patellar dislocation and then also tore his quad at the same time. So that was pretty crazy. But those dislocations obviously were pretty easy, the reduction process, but I think it would be really interesting to see an ankle dislocation or an elbow dislocation or even a hip, because those ones you don't see super commonly, I don't think. I know it mentions the rate at which you might see these, like how common, so I thought that was cool as well. But I think it was really cool talking about, as a sideline clinician, which is what we are, and the challenges that we might see in order to reduce some of these dislocations. So I think moving forward, especially, with the 2020 guidelines and moving forward in athletic training, that we're going to be able to do this. So I think having this article and just having a little bit of background before, we move forward, it would be really cool. So that's all I really have to say. See you guys when I see you guys. Enjoy your quarantine.